1 in 4 deaths in the US are caused by heart disease. So if you are diagnosed with heart disease, picking the right medication is very important. You want to make sure you have all the information needed to make an educated decision. But what if you don't get all the information needed? What if the pharmaceutical companies purposely leave out all the bad information just to get you to choose their drug? That is exactly what happened to my clients and the drug Carvedilol. Carvedilol, or beta blockers, block the release of stress hormones and angiotensin II, resulting in a reduced heart rate and lower blood pressure. It is used for different heart diseases like heart failure, chest pains, and high blood pressure. Carvedilol reaches its therapeutic effect within 1 to 2 hours after administration. It is metabolized by the liver and excreted primarily through feces and urine. When it is metabolized through the liver, it can cause problems such as dark-colored urine, vomiting, yellowish tint of your skin, and yellowish to the whites of your eyes. When taking Carvedilol, you should avoid using and operating heavy machinery, as this can result in injury. You should also avoid potassium, sodium, calcium, and magnesium-rich foods. This combination may reduce or negate Carvedilol's effects in reducing blood pressure. The pharmaceutical company mentioned some side effects like dizziness, fatigue, a runny nose, and most importantly, in my client's case, chest pains. How can a drug that is meant to cure chest pains be the very cause of those chest pains? Some side effects that were not mentioned by the pharmaceutical company include high blood pressure, palpitations, insomnia, drowsiness, skin rash, bronchospasm, abnormal lung sounds, decreased exercise tolerance, and again, most important in some of my clients' cases, depression and erectile dysfunction. There is no mention of the effects of Carvedilol's long-term use, but we can say that it damages the blood vessels of the brain, heart, and kidneys, resulting in a stroke, heart failure, or kidney failure. Carvedilol can be very dangerous for those with diabetes, bronchitis, emphysema, asthma, hyperthyroidism, and many more. My clients started Carvedilol with the hopes of curing their heart disease, but things only got worse for them. Take a look at their points.
I was taking Carvedilol for chest pains. Now my pains are worse than before, and I have high blood pressure, which was never an issue for me before. My husband started to take Carvedilol for his heart condition, and now I can't get him out of bed. He is so depressed and sad all the time. Not to mention the problems we have in bed. It's putting a strain on our marriage.
If you or someone you know has been misled by this big pharma company of Carvedilol, you may be entitled to some compensation. To find out more information, contact the Law Girls at 1-800-555-5555.